qualified as a dentist in Manchester in 1986. I started my training as a dental student back in 1982, and in those days it was a 4-year course, and I finished my training Christmas 1986 when I was still just a couple of months short of my 22nd birthday. I chose to be a dentist because I find the combination of the art and the science and the dealing with people and also the running of a business a very interesting combination. It's something that had always interested me in school, and I found that it's a challenge every single day, but it's a fantastic and a very interesting challenge. After I qualified, I spent a few years in hospital dentistry, working in regional oral surgery units in Stafford, Withington Hospital, and I also worked at Manchester Dental Hospital. Then in the mid-80s I worked at a practice in West Manchester for a few years, and then in the early 90s I was lucky enough to be able to go and work abroad in the Middle East, in Saudi Arabia for 3 years. I then came back to the UK, and in the late 90s, in 1998, I found Langley Dental Practice was for sale and I purchased it. I'd been looking for a while to buy a practice, and I'd looked at many practices in different locations around the Greater Manchester area. But when I saw Langley Dental Practice, I saw that it had been underdeveloped and underinvested in over many, many years. And I thought that this was a place where I could make an impact and make a difference to the quality of people's lives. And I'm very pleased that I made that decision. There's been a practice on site here since 1965, and the previous owner, David Brown, had worked here all that time between 1965 and 1998 when I bought the practice. The practice was quite run down with a very, very small patient base of about 1,500. Since 1998 up till now, we've probably got about 15 or 17,000 patients on the books. So there's been a tremendous expansion of patients in that time. The practice was totally underinvested, so in 1998 I first embarked upon a programme of investment. It cost me about £75,000 to refurbish the practice. However, the practice was still very, very small. It was only 2 surgeries, and my vision was for a larger, better equipped and up-to-date modern practice. So finally in 2005 I managed to secure funding from the bank, and we totally gutted and refurbished the practice to make it the 4-surgery practice that it now is. Langley Dental Practice is a referral centre for minor oral surgery for the whole of the Hayward, Middleton and Rochdale borough. So we get referrals from dentists who send their patients here to have minor oral surgical procedures like the removal of wisdom teeth or retained roots under local anaesthetic or under local anaesthetic with intravenous sedation. We've been offering that service for the past 8 years now. It's a more effective, quicker and cheaper service than having that sort of procedure done in a hospital setting. I think our plans are to continue with the oral surgery service as it stands, to try and offer enhanced evening and out of hours services for our patients. We know that there is a demand for evening work and possibly weekend work, so we are looking into that. But our most important thing is to continue to serve the needs of our patients. I think the proudest moment that I had was when we reopened the practice in October 2005 following its refurbishment and refit. Just to see the looks on people's faces as they walked in and just were completely blown away by the transformation, and seeing completely new equipment, completely new layout and brand new surgeries was probably one of the happiest and most fulfilling professional days of my life.